Hey everyone, it's Marianne Pizzatola. I wanted to do an update on a video I did a few weeks ago with retired firefighter Bentkowski, Robert Bentkowski. It seems to have that video seems to have stirred some controversy within the realm of DC 37 and the MLC. We were told that we were spreading misinformation and that Mr. Garrido had checked out our statement because it also shows up on our one pager that that if Mr. Bentkowski had transferred from his traditional Medicare program and GHI supplemental, that he risked being placed at the bottom of his transplant list for a kidney transplant. So I want to just refresh your memory really quickly with the video interview that I had with him. And here's our video. And I will let you hear him speak really briefly.
Entire booklet online, they had a little asterisk that says that certain elements have to be pre-authorized. Well, I'm already on the transplant list. Now, if I switch over to the MAP program, do I have to be pre-authorized again? Do I just slide over? And I didn't know that. So I called the 833 hotline, spoke to the people. They were very kind, and they weren't able to answer that the first time. They said, call the hospital and see what they say. I called my hospital, and they said they never even heard of the program. They weren't 100% sure, and they'll try and get back to me. Well, waited a little longer. The deadline's getting closer. I made a second phone call inquiring. I said, this is really important for me because if I get kicked out of the program because I'm not pre-authorized already, at the current rate, there is a 4 to 5 year waiting list. So my waiting time would have to restart again once I get authorization. So I pushed them. They pushed me over to a supervisor, and I explained my dilemma that I have all these problems. Could you give me an answer? Does it just slide right over? And they basically told me that, well, in order to give that information, we have to look at your records. And for that, you have to join us first. And then we'll let you know if we could authorize your kidney transplant when it comes around to it. And I was like, how am I supposed to join something where I don't even know if you're going to cover me or not cover me? Am I going to be on dialysis forever? I mean, there are so many questions that I don't have the answers to until I actually join the plan. And how am I going to join a plan when I don't know what's going to be covered or not covered?
And that, and those are really valid points. So, and that he does make a very valid point. So then I remembered this had come up once before. So listen to this video.
My wife has recently been put back on the donor list. And I spoke to your rep about accepting the tests that were done prior, now that she's back on the list. And I was told that you with MBNHEP would have to review all of her tests to approve them to ensure that she should maintain her space on the donor list. Why does she have to go through that process again when she has already been approved and placed on a donor list?
Is she under HIP VIP today?
No, we are under Empire Medicare related.
Oh, the Empire Medicare related. We would coordinate internally with the Empire Medicare related team to ensure that all of the approvals are transferred over to the program. It would be a new program, but our care management team would work with the existing team that's in place to ensure that all of those approvals transfer over.
Suppose one of the approvals is not accepted, then what?
Well, everything has been already approved through the traditional Medicare process.
Yes.
So these will all transfer over under the new program. But Mr. Bristol, I think it would be best if we speak to you directly offline. Your case is a very complex case, and I want to make sure that we get all the appropriate information from you to ensure that everything is seamless. So
So I want to share a few things out of that. At first, Kim Parker asked Mr. Bristol if he was on HIP, because he was originally told that everything would have to be reapproved once he came over, once his wife came over into the MAP program, and that she would have to be reapproved. Now, both people were very well aware, both Mr. Bristol and Robert, very aware that if they have to start that process over, it changes their position on that list. That is not something you can risk, given that there is like a 5-year waiting period for a kidney. Now, not sure what Mr. Bristol's wife's situation is. However, for Robert, Robert has a live donor. This is a person that's willing to give him a kidney or part of a kidney. And in situations like this, the insurance company not just has to cover Robert, they have to cover the living donor. So there's 2 surgeries that have to be covered under that insurance, not knowing whether the Medicare Advantage plan would cover both patients in full. And I don't mean just the surgery, I also mean the recovery for both people. And then of course, Robert would be needing continuing care through the rest of his life, possibly anti-rejection medication. So this is not something that's going to end on the day of his operation. So the first question that Kim had was, is she in HIP? And so to me, I'm thinking, why does it matter what plan she's in? If you're going to cover it, it doesn't matter. It should just matter that she was approved already in whatever plan that she's in. Then he said, no, she is on Empire Medicare related. Empire, Blue Cross Blue Shield, Anthem is the parent company. So of course they'll work with them. It's part of their subsidiary. But she asked about HIP. I think that's the question. So this message is specifically for the unions that are listening to Henry Garrido in his message this past week. Today is April 30th, so this was this past week, that he made a comment in a meeting that we had spread misinformation about this kidney issue. This isn't misinformation, and I'm going to again back it up again. This will now be like my 2nd or 3rd time. So to further prove that Mr. Bentkowski and the Organization of Public Service Retirees is telling the truth regarding this, Mr. Bentkowski had several phone calls with the 833 hotline number that he spoke about in his video interview. And so what we did was we called back the 833 hotline, which they're pretty much defunct at this point. And she didn't even know why we were calling when we called. Actually, we caught both call takers off guard, and they identified themselves as Anthem. And we said, listen, we have a call ID number that we want to talk to you about. Can you please send us a transcript of those phone calls going back to January 27th? And so the first call taker, the receiving operator, she said, I don't know how to send you a transcript of your phone call. Let me call you back. Hold on, let me call someone. So she put us on hold for like 3 or 4 minutes. And then she comes back and she says, I'm still trying to research this. I'll call you back in an hour. Of course, they never called back. Then like the next day, Robert calls and says, hey, they never called back. What do you want to do? I said, let's call again. So we called again, got a different call taker, and that call operator said, well, oh, I forgot a little fact. The first call operator said, oh, gee, this is a very long transcript. I don't know how to send all of this. Now, it didn't dawn on me at the time to say, hey, can you just, read it to me? But she just said it was a very long transcript, and I trusted her that she was going to send it. Well, when the phone call didn't come back, and neither did the transcript arrive, and they did have his phone number and his email already in their computer screen because she confirmed them with us. The very next day we called back and got a different call operator. That operator said, oh, this is just we can't send this to you, but this is just a short little paragraph. And I'm like, what? Well, yesterday it was a really long transcript, and we know it was long because he was on the phone in January for a very long time, not just with the call operator, but with the supervisor. And those notes were in there. So now we're going, oh, great. So what? Anthem is destroying evidence of calls, says not to prove that we were correct. Hey, no problem. We got proof of those. It's okay. But so here's the story with that. This is the truth. We've been able to prove this now. I've given you 2 videos. You have 2 separate retirees. If the story was different, then of course the message would be different. But clearly that Ms. Parker didn't want to discuss that issue on that webinar, that she said, oh, you're having a problem. You were told, here was a retiree told, oh, sorry, you had all those tests and we'll have to redo them all over again and you'll have to be pre-approved. And then she says, are you in HIP? And he says, no, Medicare Empire related. Oh, we'll just transfer those over. And then he pushes again, but what if they're not approved? Well, we'll have to talk to you offline. So something's not right, because if it was as simple as if you had these tests and you were already approved for Medicare to pay for your kidney transplant, even with a live donor giving you a kidney, we would know if that was already approved and you're waiting on the list, approved to be on the donor list, we will just carry you right over. That's the short answer. That says now you don't have to worry about prior authorization and pre-approvals and whether we'll deny you or anything, rather than the message that both of them got was, no, sorry, we can't do that. So, Mr. Garrido, respectfully, I'm not lying. Mr. Bentkowski's not lying. Mr. Bristol's not lying. The retirees are not lying. The problem is that you guys have a situation in your welfare funds, in your stabilization fund, that you're trying to solve on the backs of retirees. And we are telling you, don't do this. To prove further that we're not lying about prior authorizations, HHS OIG, Office of the Inspector General, put out a report that we will put on our website and link into this video that confirms what we've been saying for the last year. Medicare Advantage prior approvals are also harming retirees, senior citizens, that this is not a plan for everybody. It's great if you're healthy and you have no problems. So in this report, you are going to see a few things. At the end of the report, it lists all of the companies. They searched 250,000 claims that were filed during a specific period, I believe in 2019. It was only in like 1 week period. They searched 250,000 claims. And what they found was that all of these companies, and who are they? They list all of the ones on page 53, I believe it is, and it also includes Anthem, several of their subsidiaries, and Emblem Health. Anthem and Emblem make up the alliance of the Advantage Plan. And what they showed was that 1 in 5 claims was wrongly denied, causing a patient to have harm. That even though that some of these cases had to be appealed and appealed more than once, that some of them still didn't get approved, even though they should have been because they met CMS guidelines, and that the MAOs, the Medicare Advantage organizations, were imposing criteria that fell outside the scope of Medicare, meaning that the MAOs imposed their own criteria, not the Medicare criteria. Now you're sick, you need a transplant, you need surgery, and you're not getting it because of a falsely applied benchmark that should never have been applied to you. And so this is not a place that we want to be in our lives. Our retirees keep saying, we've been fighting for us to keep our traditional Medicare and supplemental, and that's what we want to keep. The city of New York is saying we need to save money because the federal government pays for Medicare Advantage. I'm really sorry you're going to be subject to all of these, co-pays and prior authorizations, and this will potentially hurt you. I'm really sorry, but it's going to save us money, and it's really good for you, so you should just take it. Yeah, okay. So the message to the unions, the message to Mr. Garrido, the message to Mr. Nespoli, to Mr. Mogru, who makes up the 2 largest unions of the MLC, and Mr. Nespoli of the chair. Please read this report. It probably won't even take you an hour to read it. Even if you just read the first few pages, jump to the last page. There's a big chart there that they lay out about how all of these seniors, it gives you their ages, their problems, what was falsely applied, what payments were falsely denied, and then how incremental the payments were. They denied someone from an imaging exam that cost $150 to save money, not because it would help you save your life. And that's the problem. So I want you to please follow us, click subscribe, follow along, share this with your union, share this with your local. If not, share it with OLR and tell them, listen, she's telling the truth. Mr. Bristol's telling the truth. Mr. Bentkowski's telling the truth. You're just not listening. This plan should be an option. It's not for everybody. Thank you, everyone. We appreciate you listening and following along. We're going to keep proving you that we're telling the truth, and we're going to keep proving that they're lying. Click subscribe. There will be more.